What does this latest national report reveal about Indiana?
Our information comes directly from the Annie E. Casey Foundation's 2016 Kids Count Data Book, which looks at 4 categories, including economics, education, health, and family and community. This year, Indiana ranked 30th in the national rankings of overall child well-being, which is up from 32nd last year. While this is good news, we are seeing improvements. The reality is we still have a long way to go. Indiana remains squarely in the middle of the pack for child well-being.
How does Indiana fare on the economic front?
Indiana is ranked 24th in the nation, which is down 1 spot from last year's report. And while we've seen improvements in some areas for Hoosier kids, poverty unfortunately is not one of them. More than 1 in 5 kids in Indiana, 22%, still live in poverty. This is the same as the national rate, but unfortunately is worse than Indiana's rate in 2008, when Indiana had a child poverty rate of 18%. We know that historically, poverty tends to lag behind other indicators in a post-secondary recession. There is no doubt that many Indiana families still struggle to provide the basic needs of food, medicine, shelter, and clothing, despite an improvement in the state's unemployment rate.
Are we seeing any improvements in education?
Yes, Indiana moved up 2 spots in the educational rankings. This year we ranked 23rd as compared to being 25th last year. One of our areas of improvement is the number of high schoolers graduating on time. In the 2012-2013 school year, nearly 80% of our kids graduated from high school on time, which is up from 74% just 5 years ago. More Hoosier kids are making it to the finish line and getting their diplomas within 4 years. We know that getting a high school diploma on time is the first step in setting Hoosier students up for success in their post-secondary plans. So whether those plans include going to college, beginning an apprenticeship, or heading into Indiana's workforce, a high school diploma is critical to a more economically secure future.
Where else did Indiana students gain ground?
Our students perform better in national tests, but more progress is certainly needed. For example, on the NAEP, the National Assessment of Educational Progress, when you look at the 4th grade reading levels in Indiana, in 2015, 60% of our kids were not proficient, ranking Indiana at 9th in the country. This is better than our levels in 2007, when that number was 67% of 4th graders were not considered proficient. It's certainly an improvement when more 4th graders tested at or above the levels required to be considered proficient, yet the numbers also tell us that 60% of our children aren't at that level. Experts we spoke with attribute some of the state's improvement to iRead, the statewide reading test.
What about in the math area of the NAEP test?
Indiana also showed improvement in 8th grade math. In 2015, 39% of our students were proficient in math, giving Indiana a 7th place ranking nationwide. This is a 4% improvement over 2007, when just 35% of our 8th graders were proficient in math. It's important to note improvements while still recognize that the data tells us that 61% of our 8th graders are still not meeting the baselines to be considered proficient in math.
Were there any changes in health outcomes for Indiana's children?
Indiana improved in all 4 categories related to child health outcomes, including the child death rate, the percent of low birth weight babies, the percent of kids without health insurance, and the percent of teens using alcohol or drugs. We again moved up in the rankings, and Indiana is now ranked 31st in the nation, up from 35th in 2015.
Where were our biggest gains in the health category?
The data tells us that Indiana teens are making healthier decisions as compared to just a few years ago. Alcohol and drug use amongst teens has gone down 38% since 2008. In the 2013-2014 school year, 5% of Indiana teens reported using drugs or alcohol within the past year. This compares with 8% just 6 years earlier. Obviously, parents play a huge role in preventing teen drug and alcohol use. This is an ongoing conversation between parents and teens. It's important that parents start these conversations early and then talk often to their children. It's also important that parents set clear rules and consequences for unacceptable behavior. Gains were also made in the number of Indiana children with health insurance. 93% of children had coverage in 2014 versus 90% in 2008. We know that ensuring children have access to health insurance is critical to setting Indiana kids up for long-term success.
Lastly, what about the family and community category?
Unfortunately, in this overall category, Indiana dropped one spot to 32nd in the country. This data directly ties back to the poverty data. Indiana experienced a bump in the percentage of kids living in high poverty areas. These high poverty areas are places where the overall poverty rate is greater or equal to 30%. One bright spot, however, in this category is the drop in Indiana's teen birth rate. Hoosier data shows a 32% decline in this category when you look at the differences in the numbers between 2014 and 2008.